I'm Dr. Malar, consultant obstetrician and gynecologist, specializing in fertility at Cloud9 Hospitals, OMR, Chennai. Polycystic ovarian syndrome, or PCOS as it is popularly known, is one of the most commonly diagnosed conditions in young girls and women. Unfortunately, it is also one of the most overdiagnosed conditions. There are guidelines with criteria for the diagnosis of polycystic ovarian syndrome, the latest being from the ESHRE in 2018. So what are these criteria? The first of which is irregular cycles. The first year a young girl gets her period, it is normal to have irregular or delayed cycles. After the first year of getting period, up to 3 years, if the cycles come less than 21 days or are delayed more than 45 days, then we can call them irregular cycles. But once after the 3 years, if the cycles come less than 21 days or are delayed to more than 35 days, then it is one of the diagnostic criteria for polycystic ovarian syndrome. The second is the presence of increased acne or abnormal facial hair growth or increased hair fall, both in young girls and in women. This is because of the excess of male hormones circulating in the blood. This can be either examined or some blood tests can be done to diagnose if the male hormones are in excess. So the first criteria being history of irregular cycles, and the second is clinical or biochemical hyperandrogenism. The third and the most widely used criteria is the ultrasound. Ultrasound, now being rampantly available, is used widely for the diagnosis of PCOS, again unfortunately. In a young girl who has been menstruating only for 8 years, ultrasound should not be done, or the criteria or the findings used to diagnose PCO. Only after 8 years of menstrual cycles can an ultrasound be used as a tool for diagnosis of PCOS. And in an ultrasound finding, if one ovary or if each of the ovaries contain more than 20 follicles and if their volume, each ovary's volume is more than 10 ml, then that is the third criteria for diagnosis of polycystic ovarian syndrome. Women, and especially young girls, once branded as having PCOS, experience severe anxiety and depression about that diagnosis. So, applying the diagnostic criteria strictly is essential in preventing overdiagnosis of PCOS and also planning treatment appropriately. So, all the diagnostic criteria have to be applied before branding a patient as PCO.